Ladies and gentlemen, welcome back to the Abundance Blueprint Show, the show that empowers you to design a life of limitless possibility. Every other month, we dive into the mindset, strategies, and habits of top achievers, visionaries, thought leaders to help you and I unlock our full potential and also create a life overflowing with abundance, yo. So if you're seeking financial freedom, personal growth, or just key to achieving your wildest dream, you found the right place, ladies and gentlemen. Today, I happen to introduce a man that I respect, and we had a conversation about a topic that I hold dearly, ladies and gentlemen, and it's about mental health, mental well-being. Ladies and gentlemen, I want to give you a quick heads up. My audio and video in this particular episode could be better. So just watch it and listen to it with all the love you have in your heart, ladies and gentlemen. Let me know what you think. Without wasting too much of your time, let's get into the show. All right, ladies and gentlemen, welcome back to the Abundance Blueprint Show. My name is Samuel. Today, I have the honor and privilege to welcome a specialist. Is it okay if I say you, if I call you a spiritual person, a spiritual man, because we are both people of faith?
Sure. Yeah,
Okay, sounds good. All right.
mental health is also there's an element of spirituality, spirituality in mental health.
Ooh, I look forward to getting into that. All right, ladies and gentlemen, you heard that. A specialist, an expert, a doctor, a spiritual man, is a man that I have a lot of respect for. He is a doctor. I have respect for doctor, and especially if you're doing mental health, the things that I don't understand, I have a lot of respect for you. Today, without wasting too much of our time, we'll get into the show. But real quick about what the show is about. We're just here to dive into the mindset, strategies, habits of top achievers, and you guys know it. Achievement start from being mentally okay. So I am super, super excited about this interview. It's been long overdue. We try to get this done, but he's busy. I am busy. But ladies and gentlemen, Dr. Femi, please go ahead and introduce yourself. Tell us all the good things that you have going on. Please.
All right. First and foremost, I want to really thank you for having me on your platform. I don't take this for granted. So it's actually a privilege and an honor. My name is Dr. Femi Oluwafemi Olarubofimi. I'm actually a doctor in nursing practice with specialization in mental health. I've actually been in the mental health space for over 10 years, and I actually became a practitioner roughly 2 years ago. So I've worked in different settings. I've worked in child and adolescent. I actually pioneered the child and adolescent units at the at an hospital in Murfreesboro called Trustman Hospital. I've worked in forensic psych for the state of Tennessee. I've actually worked at the detox and co-occurring units for Rolling Hills in Franklin. And I currently am a consultant for Social Security. So basically, when people come over or go over to Social Security and file for disability under the grant of mental health, so they will send them over to me for me to do a mental status exam. And based on their prognosis, that is what we use to determine if they meet the criteria to be, or whether they're eligible for Social Security benefits under the grant of mental health. So I actually, do that consulting in Brentwood, Tennessee. And I also work for the VA, the United States Department of Veterans Affairs. I've been with this organization for 7 years, and it's modeled me to be the leader I am today and the entrepreneur I am today. So I started off as a psych nurse in an acute psych unit, and I worked my way up to a managerial level. So I'm still in the managerial level, geriatric population, basically helping veterans that are basically defended our country that basically needs our help now. So they have underlying mental health issues and all that. And straight out of completion of my doctoral degree from University of Massachusetts. So the first place I worked as is as a psychiatrist provider was actually at Mercy Community Clinic in Franklin. I worked there for over 1 year, and I decided I wanted to start Nolo. It's been one of my goals because I wanted to do mental health in a different way, whereby I have more time for my patients and I'm able to listen. Because if you're working in more private sector, it's basically revenue generated. You have to see X amount of patients. So I just was with Nolo. The goal basically is to treat people with this people with mental health, to treat this population, because this is a vulnerable population. Some of them just wants to express how they feel. They just need to be listened to. So I don't keep a cap on my appointment limit. Sometimes we exceed, and I don't even build them extra. So it's just part of my passion for mental health, and also to basically eradicate the stigmatization in mental health. So, and also for credibility, I was recently awarded one of the top psychiatric mental health provider in Knowledgeville, Tennessee. So just to bring some credibility to what we're going to be talking today. And most importantly, I'm a father, and I have three adorable kids, a boy and two girls.
Oh, thank you so much. That's a lot of things to go back to there, but we would go back into them as the interview go. And I honestly think this is phase one of it. There's probably going to be multiple phases in the future. But I like the success story, but I heard you say you like to listen, but I like the heart. I can I can tell that you're passionate about what you're doing. I'm a big advocate of honing things, especially if you come from a different world like I came from. I'm a big advocate of ownership. Like, you started Nolo, and we've seen all the success story. You've shared a lot, even some things that I didn't know about you. But I want to start from the basics so that the people that are listening can know why we're here. We want to talk about mental health. For me, I grew up in Nigeria, and when you say mental health issues, we're thinking about somebody that is completely mad. They're taking off their shirt. They're eating from the dumpster. They're they're not looking before they cross the road. Basically, I'll just say it in Yoruba. For those that don't understand Yoruba, we'll try to translate it. That's Yawere. And in your own in your own opinion, what is mental health? What is behavioral health? What Tell us about this, and make it relatable that everyone anywhere, regardless of the location, Tennessee, US, even Nigeria, can understand that. Okay, this is a real thing.
Okay, thank you. So, well, I'm also in Nigeria, and I grew back. I grew up, in Nigeria. So I totally understand where you're coming from. So, but for me to address the question, and I'm going to address it in different facets. So, mental health itself, it's a representation of who you are. So mental health, in my own definition, I'm going to go into some other, evidence-based, definition of mental health. My own definition about mental health is basically your DNA. It basically tells people who you are. So it's your genetic makeup. So mental health basically encompasses your social, your psychological, and your emotional well-being. And I'm going to address each of those three keywords. Your social, what does social means? How you relate to people. Psychology basically is your mind, the head, no. And the emotional basically, as in how do you relate to people? How do you relate to things? So that is basically so a composition. So someone with a sound mental health, they're able to go about their day-to-day activities in a without disrupt. They're able to go about their day-to-day activities without having any kind of deviation or without having any kind of breakdown. So that is basically what mental health is. So they are very productive, they are fruitful, and they are able to contribute, and which is the most important thing. They're able to contribute to their environment or their society which they live in.
Wow, thank you so much. I like the keyword productivity. Uh, I was having a conversation with somebody earlier today, and I was telling the person, take a break, like take a 2 hours break. You guys as a family get a babysitter and just go away. But the point I'm trying to make is, I use the word productivity. Like when you take a break, it gives you opportunity to come back and be better. Be better at what your output is. Uh, and we live in America, and we're all about productivity. Everybody's all about giving 2x 10x more. And this is not just in any way, even in McDonald's, corporate. The question that I want to ask is, who are your clients? Are they struggling with productivity? Who are your clients? Who are your clients? I'm just curious. Is it like a
Okay.
normal high school kid, top executive? Who is struggling with mental health? I should put it out. There's a better way to put it.
Okay. So I'm gonna basically, for the purpose of the people listening, I basically want to, differentiate mental health and mental illness. So sometimes we misunderstand this. So they are basically being labeled wrongly. So mental health, like I said, is you being able to do what a normal person can do, being able to absorb some level of stress. So mental illness is basically the absence of those things, absence of you having empathy, absence of you being productive, absence of you having self confidence, whereby now you're isolating yourself. So we need to get that very clear. So you hear people tell you that, oh, I need to take care of my mental health. That doesn't mean they have a mental health issues. They understand if their mental health is compromised, it might actually affect whatever they're doing, in what capacity, whether it's at work or at home. So we need to basically kind of like differentiate the two. Mental illness is different from mental health, and which is why I'm going to go ahead and stress about the indicators of mental health is empathy, reliance to stress, spirituality, self-confidence, clear thinking, and stable relationship. And the indicators of mental illness is basically mood swings, lack of emotion. So suicidal ideation, whereby you're having intrusive thoughts, you're having bad thoughts, and also decline in ADLs. You're not able to basically, meet certain activities of daily livings, and basically you're withdrawing, social withdrawal, and you're isolating, basically, and isolating yourself. So, in regards to the population that I see ages 6 upward. So, and like I said, mental health is a respecter, mental illness or mental health is a respecter of nobody. The fact that someone is actually holding an executive role doesn't mean they don't have mental issues or mental health. So I have clients that are they are up there, they're executive, top executives, and I have clients that basically they are what we call an average Americans. I have clients that basically so mental health, which is why every one of us we need to pay a lot of attention to this because you might have some level of mental health which you might not know, and which is why they said every 4 to 5 Americans have mental health issues. They're going to have issues. So basically, what that is telling you is, if you gather 10 people together, the probability of having 4 people have mental health issues is actually high. So, which is why we have to be very proactive. Which is why we need more people to speak about mental health, because it's something that is basically eating up a society, and we need to basically end the stigmatization, which is why I've been advocating through my channel, through my platform to basically talk about mental health. It's a treatable disease. Just like the way people feel comfortable saying, you know what, I have hypertension, I have type 2 diabetes. That is the way I want people to feel about talking about I have anxiety, I have depression. So, and that would actually help them towards getting the help they need. So, in a nutshell, I see all people. There's no stereotype. There's no geographical, no boundaries. I see patients of all ages. But for my practice, Nolo currently we're only seeing patients age 6 upward.
Absolutely. Thank you for stating that. I was looking at some statistics, I think, last week. In 2022 or 2022 for US, one out of five people, as one of five people, excuse me, struggling with mental health issues. In Canada, in 2021, pretty much almost the same number, and it gives me a sad for sure. And I like the way you kind of mention hypertension. A lot of times we focus on all those big things. We exclude things like this, and I like the call for advocacy when it comes to mental health issue. But I want to bring it back to you, sir. In what ways is Nolo looking to address this issue? How are you guys trying to help resolve these? Yeah, what makes you all special?
Well, we are just like everyone in their area of specialties. What makes Nolo, distinguish? What makes Nolo different is Nolo stand from the with a mission statement of eradicating stigmatization with people with mental illness. Because we feel if the stigmatization is curbed, if stigmatization is basically addressed, if we can get rid of stigmatization, eradicate it, more people will be able to get help. So, Nolo Behavioral Health basically use a non-judgmental approach. We don't judge people. We give people like it's a platform whereby we have an open hands, open mind. We listen. We want people to be able to talk about their mental health journey, and we use evidence-based approach, holistic approach. So holistic approach is basically it's just like you want something that is tailor-made for you. You want something custom fit. That is what Nolo stand for. So we don't believe in one size fits all. So each patient that basically walk through the door or virtually, our goal basically is to make sure we see a progression, to see a steady progression, that they are basically getting what they need. We're basically meeting their mental health needs, and we're seeing improvements in their mental health. Those are the measures we actually use to ensure and the different measures, evidence-based measures like the PHQ-9, the GAD-7. The PHQ-9 is basically what we use to screen for depression. So if I'm seeing a patient with depression, my goal is to continue to see their PHQ-9 go down. If I'm seeing a patient with anxiety or severe anxiety, my goal is to continue to see their GAD-7 actually comes down. Those are metrics that tells us if medication is effective or not. So we basically use evidence-based, and also we use the motivational interviewing, which is not being a motivational speaker. So basically, you giving them clue, you're allowing them to be able to talk to you about their trauma, to talk to you about, because a lot of people they don't feel comfortable to share certain things. But you as a psychiatrist, if you are not so much in an hurry and you're able to piece the puzzle together, you are able to ask the right questions, you'll be able to get a lot from those patients. It's just like an investigator. An investigator trying to get to the root of a crime. The same thing with us psychiatrists. If you want to be a good investigator, you have to be very good in information collection of information, because the collection of those information is what would help you to basically ascertain where that patient is at that point and to get them to where they need to be, which is remission. Which is why I stated it at the initial state that this is a treatable illness. Mental health is a treatable illness. It depends on having empathy as a provider to make sure you go above and beyond. You don't just see them as a patient, and which is what Nolo. Every of our patient will always tell you the moment they are actually part of the Nolo nation. We always tell them you're a family. I'm no longer I'm your provider, but we're now family. I'm not only responsible for you when you set up an appointment with me. You can call me 24/7, and a lot of my patients will say that to you. I give them access to my number. Even when I was in a private sector, when I was working at Mercy, I had to reach out to the CEO that I'm going to be breaking protocols, because normally you're not supposed to give them your office number. But there was a time there was a shortage of a certain ADHD medication. I had to, and they were like, that is fine. And the reason for them not wanting us to give is just they don't want them disturbing us. But the thing is, I would rather allow my patient to disturb me than me basically ignore them, and they're having something, they're dealing with a mental health that could probably, take their life. So, and them having that access to you would also improve their prognosis. Because if the medication is not working, they're not having to wait until their next visit. This is something they can relate to you through a text message. So, you having that availability is actually very important as a psychiatrist, which is why Nolo actually stands out from other mental health, because it's not just about the numbers for us, it's us making sure each patient is actually getting, they're getting the quality care, and they're basically getting positive outcomes.
Thank you very much. There's so many things that I want to go back into in there. All the PH2 that you mentioned, I don't understand all of those things. So it would be nice for you to break them down, but maybe not in this show. But before we go back into medication, I want you kind of mentioned some of these earlier, but I would like for you to state it. Honestly, if you can give small explanation of some of these, that would be great. What point should people be trying to reach out to you guys? What are the signals? What are the, who, and also who should be reaching out if somebody, like, say, let's say we have a family of six and we notice some certain things in somebody. Should we trust the person to reach out, or encourage, or somebody can reach out to you guys on behalf of somebody, if that make any sense? So signals or signs or symptoms, and who is responsible for reaching out. And also if you can talk about insurance as well, like y'all take insurance, all those kind of things. Because I'm thinking for an average person that wants to make a virtual booking with you guys, and you talked about stigmatization, what should they be worried about? I want to give people confidence that, okay, yes, you can reach out to these guys if you've seen any sort of signal or this kind of signals. You don't have to worry about uh, ex- huge amounts. You don't have to worry about bills. Just everything in one. I should probably break the question down one after the other, but it's just I'm just giving them as the con.
Okay, so that's actually very in depth, and I love what you just said. As in, I love that question. I think one, this is where we have to be our brother's keeper. So if you actually notice somebody, or a sudden change in somebody's behavior, maybe this is somebody that used to be a social butterfly. All of a sudden, they're not socializing anymore. All of a sudden, you don't see them in public gatherings. So those are a clue that something is wrong. You need to basically reach out, and this is why we need to check on one another. That's why I said we need to be our brother's keeper. So if somebody is actually living in the same house with you, or sharing the same room, or your roommates, your family, whoever, even your enemy, and you see some, erratic behaviors, so whereby mood swings, they're not probably being productive, and this can even be at work. And this is why some organizations, they have what we call the EAP, which is Employee Assistance Program. So if you start seeing an employee that used to be very productive is always meeting those metrics, all of a sudden they are not meeting those metrics. Something is actually going on. You don't just basically take punitive action. You need to basically reach out. I see you're not being productive again. Is there anything going on? So I think it's just we have to be very, very intentional about it. Don't like, oh, this is not my business. Because the fact that it doesn't affect you, guess what? It could affect you tomorrow. So when you're seeing people that are doing things that are out of norm, you see people that are doing things that is basically a deviation from what you've known them to be. Those should be the red flags. You should probably reach out to them first instead of probably calling the police or whatever. There's a place for you calling mobile crisis, and there are some other resources in the community that you could also actually use. Maybe you don't want to, maybe you don't have a rapport with that person. There are other resources whereby they could reach out to those people, give them a welfare check. So, and also to answer the other layer of your question, we accept mostly commercial insurance. So, and also self-pay. So we are working, because I've been getting a lot of calls from people who doesn't have commercial insurance. Maybe they have Medicare, they have Teen Care, and or they have Medicare. There was a memo that I actually rolled out last month. We're currently working to ensure everybody gets the care. We don't want to restrict care to certain people because they don't have because of their socioeconomic status. We want to make sure everybody basically have the care because which is what NOLO stands for. So which is why currently our website is down. We're trying to revamp our website whereby we could actually see patient that does not have commercial insurance or does not have the financial buoyance to basically pay for a session because a session with us is actually cheap, is $150, but to be candid, not everybody can afford that. So we're doing everything within our might to ensure we're reaching everybody irrespective of their socioeconomic status, which is why the website is currently down. We're revamping, we're extending healthcare to those population using sliding scale based on your income. So that is going to take time, but we are basically working actively on that. And also to reach us, which is something we're probably going to talk later, there are different platforms you can reach us. So we are easily accessible. You can reach us through our social media platforms. You can even reach us through LinkedIn. I'm very, very active on LinkedIn. So there are so many avenues which you can actually reach out to Nolo. And sometimes even some people would call me for consultation. Not all consultation are you can call. This is what is going on. I can actually, as a mental health professional, I could actually go, this is probably because there's some situation that does not need medication or that does not need any treatment, probably just need a psychotherapy. So now I'm basically deviating now. So we have pharmacological aspects, we have the psychotherapy. So because some people they are not basically open to Western medication, which is why the flexibility as a provider comes in. So you have to be able to cater for that population that does not believe in medication. So don't just feel like oh, they're just basically being naive. You have to be cultural sensitive. Probably it's because of their culture. So that is when the sensitivity, and I'm appreciative now that it's part of what is being embedded into healthcare. You have to have that cultural sensitivity. So if they don't want to use, as in, pharmacological intervention, there are also other measures. You could reach out to their spiritual leaders to talk to them. And if it gets to a point whereby it's not working, so maybe that is when we can now like, oh, you know what, you might probably need some, medication management. So I think that is where you should start from. And when I see patients, I don't just, it's not just about medication. Because I think a lot of prescriber, because of the fact that you have a DEA, you have the license to be able to prescribe. Not every patient you need to prescribe medications to. There are situations that in my practice that patients have come to me. It was an issue of infidelity and all that, and I just figured, okay, this is not something that I need to medicate. But no, this this is mindful. So they need counseling. I did some counseling and I refer them out. So sometimes you have to use your judgments. So treat, which is why I said we don't believe in one size fits all. You have to look at each cases on individual basis and then use your intuition and use your professional experience, your professional skills, and your empathy as well to make sure you're giving them the care they need, to make sure the care plan basically meets their goals and their outcomes.
Thank you so much. I really, really like the response. Well, I didn't ask you the question about medication, and you just kind of went into that. Being culturally sensitive is extremely important. Spirituality. In your own opinion, how big is spirituality to our mental well-being?
So spirituality actually plays, a fundamental role in our well-being. And spirituality, we're not talking about church now. So it's basically listening to your mind. So there are different ways you actually. So it's part of how you get, healing. So it doesn't have to be church, like I said. It doesn't have to be a mosque. So spirituality is kind of your own spiritual belief. If that spiritual belief is going to basically provide you the therapeutic cure or treatment or skills, coping skills you need, that is something we basically encourage. And it might be as simple as basically, listening to inspiring music or listening to people that basically their story inspires you. That might basically motivate you. And your spirituality sometimes is you waking up and saying something positive to yourself, positive affirmation. So you basically, as in that is what, and this is actually part of what we do as well, because when we talk about cognitive, which in the subsequent, sessions, we're going to start going into deep. When we're doing CBT, cognitive behavioral therapy, or cognitive therapy, we're basically replacing bad thoughts with positive. So spirituality basically is an holistic approach, which helps a lot of people that are dealing with stress to basically help them to be able to cope with their stress in such a way it doesn't affect their day-to-day life. It does not basically sets them to a place whereby they're not productive in the community, or they are not basically able to meet, they're not basically fruitful. So I think that is what, that is where the spirituality comes in. So like I said, it's not, it's not a makeup of a church or a mosque or whatever. It's just with your personal belief. If you feel going to this particular place brings you healing, that is your own, spiritual ground. If you think, no, no, listening to this thing actually brings me healing, that is your spiritual ground. So that is, all I could say about, just for because of time constraint. So that is, in simplicity, that is what spirituality, entails when we talk about mental health.
That's a lot. You've given us a lot. For me, I am better for this interview. Honestly, it's opened my eyes to so many things. I have further readings to do, but where can people find you? I know, by the way, your content on LinkedIn and social media are really nice. Thank you for doing that. Please keeping it up, sir. Where can people find you? Where can people make appointment or bookings? And what should we be looking forward to coming from you guys?
So currently, all we're doing now is we're basically seeing patients virtually, because one is actually convenient for a lot of patients. So because you don't have to drive for a 30 minutes appointment or 40 minutes appointment or a 1 hour appointment. So it's basically makes it easy, and it allows for accessibility to care. So you can actually, you can, if you see me on the streets, you can reach out to me. I'll be willing to give out my number to you. And I'll be willing to even give you free consultation and all that you need. And I don't have to be your provider if you feel I'm not a good fit. But if you want to basically, get care from one of the best, which is why Nolo provider, the founder and CEO, Dr. Femi, which is my humble self, I was actually rated one of the top psychiatrist in the city of Knowledgeville. So that actually, brings some credibility. You can reach us on our social media and do, which is basically going to run on your screen. So on Instagram is going to be Nolo Behavioral Health. On Facebook is also Nolo Behavioral Health. And you can also follow us on, you can follow me on LinkedIn, Femi Olaribofi. Our website is nolobehavioralhealth.com. Like I said, we're currently revamping that website. So the website is currently not live now, because we're trying to put some more content. And like I said, out of our goal to basically ensure that we are reaching out to those who cannot afford to pay, 150 for a session, which is, cash pay, or those who doesn't have commercial insurance. So, which is why we're basically revamping that, website to make sure those people their needs are met. And I'm going to give out my number as well. So if you can also give me a call, 615-635-4575. 615-635-4575. You can text me, you can call me. I'm available 24/7. And I say this, I've had patient call me 12 midnight, and it was like, Doc, what are you doing? This up. So I'm like, I've made it clear to you guys, I'm your doctor 24/7. So I'm basically available 24/7 to my clients and for those who want to get the care from me. So that is all that I, as in, those are the platform we have. And in terms of expansion, we're basically, still, we're looking for the right location. So because Nolo actually believe in excellence, and for those who has followed us, they could see that touch of excellence. We don't just want to get a space that would not basically give us the room to basically do the things we want to do. So the long term goal is that we're gonna be having our own, office location station in Knowledgeville. So if you don't know, Nolo basically is Knowledgeville, so Nolo Behavioral Health. So the headquarters is going to be located in Knowledgeville. And currently, I've had a lot of psychologists that are willing to partner with me. So we might be having a CBOC. So a CBOC is basically a community-based clinic, a branch basically in Franklin. I'm actively working on that. So it might be probably once or twice. And other initiative also for us to ensure that we're reaching people, we're able to take care to people. So I'm currently working on a process improvement whereby is mobile healthcare. So what does mobile healthcare means? So basically, maybe once or twice in a month, I'm going to be driving to my client's house to provide care to them. And lastly, we're currently working with a group home. We're also working for group home. If you have a group home and you're looking for a provider to basically provide out of off tour coverage, we're currently going to be effectively from the 1st of June. I'm going to be doing that for a group home whereby I'm basically going to be the psychiatrist over this group home, and we're going to be providing care to them. So we're basically expanding. We're very strategic. We want to make sure everyone is actually being catered for.
Very, very good. I really like it, sir. I like the story. I like the ambition. One last question before I let you go, because I know you're a busy person. I ask every of my guests and friends this question: what does abundance mean to you, and what does that look like to you?
Okay. Well, I think abundance to me it's that's a relate no that it is a relative term because abundance to me might be different to you. So I think
Absolutely.
So I think it's a relative term. There will be no right or wrong definition to abundance. So abundance is basically having surplus, but surplus to one person might be deficit to somebody else. So I think to just like I said, is a relative term. So it's just about your capacity. That is where you're gonna. It's basic also based on your perception, your perspective. That is how we can define abundance. So I would not be able to give you so because I don't want to mislead. I think I basically answered your question. There's no wrong or right. So it's a yeah. So it's
Absolutely.
just a thing of it's just a relative thing. It's just about capacity because somebody who has there's an adage in where I came from. If you've not been to somebody else father's farm, you think probably your dad has the biggest farm in the in the city. So that is the way
Yeah.
abundance is. So it's just a thing of the mind and about your capacity. So God is not going to give you what you
Yeah.
don't have the capacity to hold. So and that is why
I
it's
like
even
it.
scriptural. So he gave somebody one seed, one actually came back with 10, one came back with five, and one came back with one. That is, like I said, I'm still going to relate it back now to mental health. So it's a function of your mental health,
Yes,
it's
sir.
a function of your psychology, it's a function of how you see things, your perspective.
I love it. And that's kind of my own answer. To me, you're right. Abundance is relative. For me, when I ask the question, what I oftentimes get is different things, which is expected. And to be honest, the top of it all is the presence of peace. It's not the things, it's the presence of peace and just making progress in our lives. And I like the way you mentioned mental health. For me, abundance is just being able to do what I want to do, not financially in this case, but being able to say, okay, I want to go to point A to point B, being able to just, you know, I have a peaceful coexistence with my small community, so it's the presence of peace for me. And of course, I would appreciate more money for sure, but we've seen it, more money oftentimes does not lead to peace in
The
most
rich
cases.
also cry. That's
Sir,
why they
I
say the
really,
rich also
really.
cry.
Yes, sir. Yes,
Yeah,
sir.
money doesn't yeah, even the yeah. So money doesn't bring happiness sometimes. So I think like you said,
Yeah.
it's being able to do what you want to do. So which is kind of like realization, being able to achieve what you set out to do, whereby you're not in the
Ooh,
box.
I
And
like
also
that.
living,
That's
yeah,
deep. That's
living to
deep.
your full potentials. Because some people are not living to their full
Oh,
potentials. So living to your full potential
yes,
is
sir.
so just to basically add to what you said, is basically living life, a purposeful life. a purpose-driven life
Ooh,
whereby we are impacting people.
yeah,
Because life should not be about you
yeah,
alone. The moment you're not impacting other people, you basically you still need to do more. It's telling you there's still a lot of ground to be covered. So abundance should be beyond people
yeah.
around you. You should be able to impact that. The moment I always say something to myself, when I leave a place, I want, even though they're able to fill that place, I want a void. So it comes with what you bring to the table. It comes with what you carry,
Mm,
your capacity, and that's why I use the word capacity.
I like it. I like it. Sir, this is not the first and the last time we'll have you. I hope when we reach out again,
Definitely, I'll
you would
definitely.
please and please come give us your time. Bless us. Thank you so much. I really appreciate it. And we will put all the links everywhere. The abundance community we will be reaching out. I'm a big advocate of mental health. I love talking to people about it. And thank you so much for all you do in this community, sir. We really, really appreciate it. God bless
Me
you
too.
and
Thank you,
bless your
and yeah,
work,
thank
sir.
you for your service. And like I said, I'm always available. Yeah,
Awesome.
I'm always going to be available. Thank you so much, and I really appreciate you
Thank you
giving me
so
this
much.
opportunity to be on your platform.
Ladies and gentlemen, Ladies and gentlemen, thank you for following through and listening all through. A big thank you to Dr. Femi and the Nolo family for giving him the time to be on the show. There are three key takeaways from me. Let me know what your key takeaways are in the comments and all these good places that you can find the show. Number one is mental health is different from mental well-being. And key takeaway number two is these are treatable diseases. Regardless of who you are, top executive, the last person on the chain of command, go get help. The sooner you reach out, the better. The sooner you reach out, the quicker you get help, ladies and gentlemen. And the last part is BAR. And the key takeaway number three is be your brother's keeper, ladies and gentlemen. I'm a big advocate of reach out if you feel like you're falling apart. However, if you see somebody falling apart, reach out to them. Don't judge them. Let's get rid of stigmatization. If you find value in this show, please comment below. Let me know what you think. Let me know how we can get better. And just hit the subscribe, like, put your comment in the comment section. More importantly, ladies and gentlemen, go find a way to connect with Nolo. Please, if you're not in the time zone that they are in, if you're in a different country from them, find similar provider in your location. Find similar provider so you can get help. We're all we got, ladies and gentlemen. Let's keep chasing abundance because we all deserve it. God bless you.